Welcome back to Face the Nation. We want to go now to Wesley Lowery, CBS News correspondent for 60 in 6, which is a new digital program featuring 60-minute style storytelling in just 6-minute episodes on the streaming service Quibi. He was formerly at the Washington Post as the lead reporter covering police shootings and the Black Lives Matter movement. And as we mentioned earlier, he won the Pulitzer for his work. So Wes, you are formidable, and we are glad to have you.
Happy, not happy to be here. I honestly, as none of us would like to be talking about this again, obviously. Right?
I think the country would agree with you right now, but I know you've been on the phone and speaking with some of the activists who are in the streets and cities around the country. What are they telling you?
You know, we're in this moment right now where all of us are asking, of any political stripe, and even those of us who are not, explicitly partisan or political in any way, are asking, how do we stop what's happening in the streets? No one wants to live in a world where the streets are burning, and no one wants to live in a world where people are killed in the streets, right? Mm-hmm. And what the activists are saying is, you all haven't been listening to us, right? You listen to the protest chants, right? One that's very popular during these demonstrations, not just the George Floyd ones, but historically. Indict, convict, send the killer cop to jail. The whole system is guilty as hell, right? And what the activists are saying is, we have been saying the system is foundationally and fundamentally broken, and you've been giving us speeches in a body camera. You've been charging one individual officer, who then, by the way, might beat the charges. Mm-hmm. Or you've been firing an individual officer, and I've done reporting to suggest that many officers who get fired get their jobs back. There's actually a belief that many of these officers in Minneapolis may get their jobs back who were fired, right? So, again, what the activists are saying is that you all have not been listening to us, that this was in so many ways inevitable, right? Again, the protest chant, right? If we don't get no justice, there will be no peace.
But is there something, I wonder, that's very specific to this moment? Because as you've said, this is not the first case. This is one of innumerable instances of police brutality that our country has talked about in the past few decades. What exploded it now? Is there something about where we've been as a country with the economic crisis, with the pandemic? Why?
I think all of those things are obvious, extremely short-term factors. Certainly isn't helpful that a bunch of people, and by the way, Black Americans, those who are storming the streets, although certainly racially diverse groups, Black Americans who started this, who were more likely to get sick and die because of COVID, right? So the demographic group most likely to have spent 2 months without human contact in fear of their lives, right? That certainly factors in. The demographic group, the data tells us, that was among the most likely to lose their businesses and their jobs because of the economic downturn. But we also can't attribute it just to the short term. Let's think about the medium term, the era we are in. That every time we open our phones or our computers, we being all of us, we watch another video like this, right? And for years, it's been these pleas from elected officials, from policing officials, from the media, from everyone. Well, if you guys just calm down, I promise we'll fix it. We promise we'll fix it. We'll have a meeting. We'll have a town hall. Someone will give a speech. And at some point, one of the examples I've heard people have said to me, and so now I've started saying it to talk about where the activists are, Lucy can only pull the football so many times before Charlie Brown punches her in the face.
That's quite the analogy. One of the things I want to ask you about, because you are in touch with those on the ground, is what the Justice Department, what the White House has said, which is that the protests, which you are laying out as peaceful and well-intentioned, have been infiltrated by far left-wing, specifically radical groups. Antifa was mentioned by the National Security Advisor. What truth is there to this?
Every demonstration I've ever covered, anytime I've ever been in the streets and interviewed people, and that's not untrue of these, but it's not exclusive to these. Everyone, Ferguson, Baltimore, Cleveland, Milwaukee, the list goes forever. In all of those cases, there's a mixture of people in the streets, right? There are people who show up because they want to march, they want to yell, right? But those people never have control of everyone who shows up. There is always a mixture of folks. And again, not just white anarchist groups or white Antifa, Black people who throw, a brick at a cop or, do the right thing, a trash can through a pizza shop window, right? That the reality is if you were to look at the mixture of people in the streets in American cities, the answer is probably all of the above. I think sometimes we get too focused on this. Well, is it one specific group that's trying to, again, the reporting will start to look at what exactly is there, but I've never once been in the streets during one of these protests where the reporting has bared out that it was one specific group pushing, in some deliberate way pushing all of this. The reality is it's always a confluence of people, a confluence of anger and frustration, and it can be too easy for us to think it's just some outside agitator who, when you read the after-action reports and the contemporaneous coverage of basically every riot that's ever happened in the last 100 years.
Right.
The local elected officials always say it's the outside agitators, it's not the people from here. We've seen in the last 48 hours, the officials in Minnesota claim that, and the independent reporting proved that the vast majority of people arrested were local.
Well, the Attorney General said this morning, for the state, that is, was saying that there is a lot of suspicious behavior, cars without license plates, things that appear to be designed to cover up the identity of the individuals involved. Certainly,
right? But is that license plate is that car without a license plate from a state over or from a city over, right? Like the reality, the suggestion that people locally may not be upset, may not be frustrated enough to take such action, I guess sometimes I think misses it. It's unquestionable, right? That in all these protests, and again, it's from reporting, from being there on the ground, from talking to folks, it's unquestionable that there are people who show up explicitly to create chaos. No question.
But so some of the elected officials we've been talking to at the local level say, protests are good when they're organized. That's what the Atlanta mayor said. But basically, go express yourself at the ballot box. She told people to go home when she saw the violence on Friday. And then we just spoke to the mayor of St. Paul, who was saying there's a real conversation that needs to be had, but that's about reforming a system.
Correct.
So what exactly needs to be reformed? And when do the protests stop?
What the activist would say is literally everything, right? what the activists would say is that American policing, as we currently understand it, as we've currently conceptualized it, is a legacy of slavery. It was created to control and in many ways abuse Black Americans, to keep them subservient to a white majority. What the activists would argue is that a system that was constructed that way will never be able to provide equitable positions. And so again,
being able to fire cops more easily, as the mayor was talking about, things like that, you say even if that's done, not enough.
It's very hard to see how piecemeal reforms like that would, if there is a structural and systemic issue, can you solve a structural and systemic issue with Band-Aids? And again, the data all suggests there is a structural and systemic issue. And the types of reforms we've talked about are individual reforms, firing an individual officer who does an individually bad thing, right? If there's actually a structural problem, that doesn't fix it.
All right, Wesley Lowery, thank you very much.
Thank you
for your reporting and your analysis. We'll be right back with the latest on the coronavirus pandemic. The total number of COVID-19 cases worldwide crossed the 6 million mark yesterday. More than 1.7 million of those are from right here in the United States. CBS News senior foreign correspondent Elizabeth Palmer reports from London. Liz?
Margaret, at least 6 million people have now been infected with the coronavirus worldwide, and the number is still growing, especially in a handful of developing countries. India is struggling. The infection here is steadily spreading beyond the cities, in part because the country has one of the lowest testing rates on Earth. A strict lockdown in the worst affected areas has just been abruptly extended for one more month. Brazil, too, remains an epicenter, as many people now die from COVID every day in Brazil as in America, which still has the most. By contrast, Italy, which was hit so hard early on, continues to reopen. Tourist sites like the Leaning Tower of Pisa have rolled out the new normal, a gadget that glows red when visitors get too close. In other countries over the worst, there's another sign of recovery. Schools reopening, from South Korea to Holland, where there's a new classroom normal, plexiglass pupil shields.
And they're off and racing, a bit of a jump there.
And in Australia, the classic Uluru camel race went ahead, even though spectators had to watch online.
Tech's taking out the cup.
But this pandemic is far from over. The poor everywhere are especially vulnerable.
Good afternoon.
So there was international dismay when Donald Trump announced he was pulling the U.S. and its money out of the World Health Organization. So far from the WHO, there's been no official reaction, but maybe a coded appeal from its chief.
Science is giving us solutions, but to make the solutions work for everyone, we need solidarity.
Now, the issue certainly would have come up at the G7 summit that President Trump hoped to host in June. But he's now postponed it after Germany's Chancellor Angela Merkel made it clear she would not travel to the United States in the pandemic. Margaret?
Elizabeth Palmer in London. Thank you. We go now to Westport, Connecticut, and former FDA Commissioner Dr. Scott Gottlieb. Good to see you again.
Thanks.
We were speaking earlier with the mayor of Atlanta, who told her constituents, if you were in these protests, you need to go get yourself a COVID-19 test. When you look at this, these large-scale gatherings around the country, what is your prediction of what this will mean?
Well, look, there's going to be a lot of issues coming out of what's happened in the last week, but one of them is going to be that chains of transmission will have become lit from these gatherings. And Minnesota, one of the hard-hit states by the protests where you've seen large mass gatherings, that state has been seeing an uptick in cases to begin with. Even before these protests started, we saw rising hospitalizations in that state. So this country isn't through this epidemic. This is continuing to expand, but at a much slower rate. But it's still expanding, and we still have pockets of spread in communities that aren't under good control.
It sounds like you're saying this could be an accelerant. What we know already from the data is that Black and brown Americans are disproportionately impacted by the virus itself. They're also disproportionately impacted by the job cuts, but they are carrying the burden of this outbreak. Why do you think that is happening, and what is the policy response?
That's right. Black Americans and Hispanic and Latino Americans have been disproportionately impacted by COVID. I think it's a symptom of broader racial inequities in our country that we need to work to resolve. Really, you have to look at it across two dimensions. The first, why are there higher rates of COVID among these communities? And second, when people in these communities do get COVID disease, why are they dying at a higher rate? And the first has to do with a lot of issues of socioeconomic factors, low income, issues related to overcrowded housing, where people work, the fact that they have to take crowded transportation, that they work in essential jobs, or they've had to continue to work and didn't have good PPE at work. We've seen Black communities and Hispanic and Latino communities disproportionately in these kinds of circumstances. The second has to do with poor access to health care, mistrust of the healthcare system, some discrimination in healthcare. And also, back to the first factors, the economic factors. You see a higher burden of chronic disease in Black communities and Hispanic communities in this country, often related to income inequities. And stopping the pandemic is going to depend on our ability to take care of our most medically and socially vulnerable. We absolutely need to resolve these underlying problems to eliminate the risk of pandemic spread and of the epidemic.
Well, we know the federal government is leaving the testing strategy part of this up to the states and local governments. So what should be the response? What do you tell governors to do? Is it triaging testing for these communities?
That's exactly what it is. It's taking resources and trying to get it into communities that you know are being disproportionately impacted by the disease. You think of people from communities that are disadvantaged. They already lack access to health care. They lack access to testing. So they're not only at higher risk, they don't have the same health care opportunities. And so you try to bring the testing into those communities, into work sites. The other thing we need to do is make sure that COVID doesn't become punitive, that having a diagnosis of COVID disease doesn't mean you lose your job, you lose your wages. And so we need to support people through the illness. We need to encourage them to get tested and self-identify. And so you really need to focus the resources on the medically vulnerable communities where this virus is going to spread more actively. So it's not just Black and Hispanic communities. It's also institutions like nursing home, places where there's vulnerable Americans, but you need to be focusing the resources on those settings.
You're talking about the most vulnerable in this country. We know Dr. Fauci in particular has talked about the most vulnerable around the world. I want to ask you what you think the health impact is of what President Trump announced on Friday, which is that he is pulling the United States out of the World Health Organization ahead of the time frame he had laid out, that he's just full scale cutting the U.S. off. What impact will there be?
Well, look, the president raises valid concerns about the WHO, but this is not the time to be pulling out of the WHO, and I don't think pulling out was the right measure. We could have tried to reform the WHO from within, and we could have put pressure on China through the WHO, forcing China, for example, to admit Taiwan to the World Health Assembly. I think the net impact is going to be that we're seeing now this virus become epidemic in other parts of the world, particularly the Southern Hemisphere. It hasn't reached West Africa or South Africa in high numbers yet, but I think it will. We see it epidemic in Brazil, epidemic in India. The World Health Organization is a more important entity to a lot of those countries. It is their CDC. And so pulling out of the WHO right now and pulling away resources from that organization, I think is going to contribute to some of the adversity and hardships that these countries face as they try to battle COVID disease.
And do you just mean for COVID-19, or are you talking about having other health impacts?
Well, there's other health impacts. A lot of the programs that the WHO runs, we're going to try to support through other organizations. But there are programs that the WHO is the only contributor to those programs, and those are the ones that are going to suffer the most. So, for example, the polio eradication program, as best I can tell, the only entity funding that program is the WHO. So it's going to be hard for the United States to support that through other organizations. So you have to look at the programs where the WHO is the only funder. Those are going to be the hardest impact immediately by this.
Back in this country, the CDC did issue a new timeline this week. It basically pieced together some of the reporting we already knew, but what it said was that community transmission likely began in late January or early February 2020 after a single importation from China, followed by multiple importations from Europe. What does that reveal to you?
Well, this was looking at Washington State primarily, where we had a case that had come in mid-January, and we thought that was the case that lit the spark of community spread within Washington State. What we learned was that wasn't the case. That didn't lead to sustained transmission, but there was a later case in early February that then led to a chain of transmission that ultimately resulted in the outbreak there. What it tells us is that we had an opportunity well into February to try to quell the outbreaks that ultimately led to this epidemic. And so we had a later window. So if we had gotten testing in place in early to mid-February, that would have helped potentially spot some of these index cases. Also, the report talked about this, what we call syndromic surveillance, basically that we were relying on data on how many people were coming into the emergency room with respiratory symptoms or how many people were reporting that they had the flu but then testing negative for flu. And what we were saying was we weren't seeing a sharp uptick in that, and therefore COVID wasn't spreading. But when you look back at that data, it wasn't flashing red, but it certainly wasn't flashing green. It was flashing yellow. It was a high end of the normal range for the last 15 years. And in fact, there were researchers like Mark Lipsitch and Caitlin Rivers and others who were reporting that at the time, that the data wasn't saying that there's definitely something else spreading, but what the data was saying was there seems to be a signal that something could be spreading. It was at the high end of the range that we would have expected in a normal season.
So there were warning signs. Dr. Birx said on Friday that about 5% of America or so has been tested. What do you make of those numbers?
Well, I think the operative number, look, we've ramped testing substantially in this country. There's no question about that. We're doing about 500,000 tests a day using primarily PCR, and that's going to grow substantially as we get new systems into the market. I think the important statistic to watch is how many tests are being run per day, not the total number tested over the last 3 months. And we're testing about 500,000 a day, which is high. I think that that's a good number, and we're going to continue to grow that. I don't think testing capacity is going to be the challenge heading into the fall. I think getting access to testing is going to be the challenge. There'll be enough machines to run the tests. What there aren't going to be are sites to go get tested very easily. And that's, again, why we need to get testing into community sites, into workplaces as well, so people can get tested easily at work, especially places where people work where they can't social distance, where they're working on, for example, a shop floor or a warehouse, where they're coming in contact with a lot of other people, so they face higher risks.
Dr. Scott Gottlieb, always good to talk to you. We'll be back in a moment.
Thanks a lot.
Finally, that grim milestone. More than 100,000 Americans have now died of coronavirus. It's an enormous number, and the value of those lives is immeasurable. On a single day in 2001, America lost just under 3,000 people aboard the 4 hijacked planes and the attacks on the World Trade Center and Pentagon. That earth-shaking day spawned the 19-year-long war in Afghanistan. 2,300 Americans died on that battlefield. Another 4,400 U.S. troops were lost in the fight for Iraq. Those figures don't capture the horror or the extent of our grief, nor the impact on the rest of the world. Yet that's a fraction of the more than 103,000 lives claimed by the coronavirus on U.S. soil in the past 3 months. Each day, nearly 1,000 Americans die from it. The attack on Pearl Harbor killed 2,400 Americans in less than 24 hours, launching a generation of Americans into the Second World War. It would take 43 Pearl Harbors to equal all of those lost to COVID-19. But how does one write more than 100,000 obituaries? If these numbers seem unfathomable, consider them another way. That's the size of the entire population of South Bend, Indiana. And how do we continue to say that we're all in this together when the numbers show that we're not sharing the burden equally? Black Americans have a COVID-19 mortality rate nearly 2.5 times that of white Americans. Hispanics are hospitalized at a rate approximately 3.5 times that of whites. Those figures reveal the tragic consequence of income inequality, healthcare access, but also the fact that people of color make up the majority of frontline workers who we all rely on in this fight. The grocery workers, the police, the healthcare aides. We've all been warned to brace for more loss. The White House projects the death toll may climb to 240,000 Americans, roughly 4 times as many dead as the number of names inscribed on the black granite of the Vietnam Memorial. The lives already lost outnumber the fallen from the wars in Vietnam, Korea, Afghanistan, and Iraq combined. The glimmer of hope that remains is the fact that the majority of those who get the virus do recover. But for those who do not, the loss is incalculable. We'll be right back. That's it for us today. We want to leave you with something uplifting. Some new pictures just in from space. That's the SpaceX rocket docking successfully at the International Space Station. It launched yesterday from Cape Canaveral in Florida. CBS News will have continuing coverage of the rest of that mission. As for Face the Nation, we will see you next week. Stay safe. I'm Margaret Brennan.
Vehicle pitching downrange.